All right. So we need to discuss the Rural Health Transformation Program. Anybody want to kick us off with that?
Yeah. Are you going to share the PowerPoint slides, or is it your how you and Shelley were doing this?
I don't have PowerPoint.
You don't have PowerPoint slides?
Yeah.
I can just go ahead and kick it off if you guys want to pull up the actual survey that we just did this morning.
Oh, yeah.
Okay. So welcome, everyone. We're going to talk a little bit about the Rural Health Transformation Program. I'm Shelley Argabright, the Director of Population Health Innovation and Informatics within the Garrett County Health Department. We are at the local management board meeting, and I will let you know that this is a recorded meeting, and that we are going to be taking a written transcription. It may be created by an AI tool such as Gemini. Participants may ask for the recording to be paused or for their comment to be removed from the transcription. After the meeting, we will use the recording and or the transcripts to complete the following template that we're going to go over. And then we are going to submit both the recording and the transcript to MDH, the mdh.transformruralhealth@maryland.gov. And I'm going to kick it over to our health officer or our deputy health officer to just give a brief general overview of just a general overview of the Rural Health Transformation Program.
Yep. So I can go ahead and just give a brief overview. So the Rural Health Transformation Program was created from HR 1, the Big Beautiful Bill, and it sets aside, $50 billion for all 50 states for a 5-year period. So we're looking at around $100 million for the state of Maryland. And what the program is designated to do is improve rural health access in Maryland. And so that's through multitudes of different steps, whether that's innovative care, workforce development, and preventing disease. So part of this program is having this listening session, which Shelley pointed out. And so what we really want to do for this is just have a conversation, see where the most needs are of the community members.
Thank you, Martin. So MDH sent us a template, and it's broken down into themes. And so the first question, if you want to bring that up, John, is what is working well in your community to support your health and the health of your neighbors? And you can see the boxes there. So it's a check all that apply. And we are hoping, as Martin said, to have a discussion. So I'll just read them. And again, this is what is working well in your community to support your health and the health of your neighbors. So the first one is strong social cohesion and a sense of community. Second is volunteerism, mutual aid, neighbors helping neighbors, a local nonprofit or faith-based support. We want to add details here about specific organizations. And then the fourth is strong public health or healthcare partnerships, creative community-led solutions, effective outreach and communication, culturally responsive care or services, and access to local health programs or clinics. Food security initiatives, and access to mental health resources, and then any other topics that you feel are important.
Okay. First,
So, go ahead.
I think our community is blessed with the Mountain Laurel Federal Health Clinic and the health department, and especially Garrett Regional Medical Center. So we just have a lot of wonderful programs going on in all three of those places that are intending to add physicians and other specialists in the county, to add clinics throughout the county and available clinics for health department programs and moral programs are scattered from one end of our county to the other. We just have all of that covered. What we don't have covered is transportation to those things that are available through those three entities.
Thank you. So I think the box that we could check as far as what is working well is the access to local health programs or clinics, meaning that they are here. But the ineffective part is that people can't get to them always. So the transportation.
Right?
Okay.
Especially seniors.
Mhm.
Seniors often can no longer drive and may or may not have family here who can help them to get there.
Yes. So that brings us down to question 2. And so we would certainly want to check that box. And the first one, it says, what challenges do you or your loved ones face in taking care of yourselves? And so the first box, as far as the first theme, is lack of transportation.
Right.
Okay. So let's focus a little bit more here on what else is working well before we skip to our challenges. Does anyone have any other thoughts about what's working well in Garrett County?
What do you all think about social cohesion? Do we have that or not?
Somewhat within communities, but then we're a big county and not everyone is in a community.
Yeah, you're absolutely correct on that. You're absolutely correct. So like the towns themselves, they have a strong sense of identity. I think we saw that in the enough communities.
Right.
The towns themselves, they do. They form their coalitions, they have their volunteers, they have their programs, and they have, what they do and what they support. But we're so spread out that we're missing a large group of people that are
I want to say that 75% of the county lives outside of a
Well,
municipality.
definitely.
I think that's true. 'Cause there's,
And it leads to the isolation that our seniors are experiencing. And, contributes obviously to the transportation issue.
So do not check that first top box.
I do think that we have really good volunteerism here.
We do.
I see that everywhere.
So I think it depends on, again, what community you come from.
Mhm.
Because if you talk to volunteer fire departments in Oakland especially, they're critical of the lack of volunteers that they're getting.
It's generational.
Okay.
Any organization, and heaven knows I'm in many, it is very difficult to get active younger members of any, even social groups. I belong to Delta Kappa Gamma women teacher group. And yes, we can get people to join, but getting them to attend meetings and participate is another issue. And I think that's true for the fire departments. I remember in the little town of Midland that I grew up in Allegheny County, our fire department had a junior fire department at one time. And those are the members that are now the fire department. And I don't know that they have a junior fire department anymore.
Can't imagine they do.
Truly.
And I think that's in part because the younger generations are so busy with their families, where before everything was there in Midland. Or maybe just down the road in Coney, right? And now they're having to drive 30 miles to get to the sporting events. Now, as we shift things outside of our small communities, and that the parents are having to go all over the county to get their kids to where they need to be, then that becomes they have
And you
less
could
fun.
also, because back then you were also working at the Celanese or the Kelly
Yes.
factory and
Yes,
making
they
a living wage.
Right.
And
Yeah,
now,
and you had stay-at-home moms.
right,
Yep.
so there was a,
So I think that's playing into it also.
absolutely.
How about local nonprofit or faith-based support? Is that a strength, a good thing, or not?
Well, a lot of our food banks are operated by our faith-based
Yeah, I think
community.
that's definitely a strength here.
Yeah. That's what has been the case. And you have two main churches. I don't know about the others, but I do know the Laughlin Church of God and Crossroads do a lot with their families and for their families. And some of the other churches might be missing the boat by not doing more non-religious things
Mhm.
with their people.
I think our public health and healthcare partnerships are good.
Yes.
That's been my experience.
I would add to that as a note that it goes within the public health. I mean, you got to take in our agency partners that work so well with the public health initiatives and those partnerships.
So the creative community-led solutions, we just spent a lot of time on, and I think that we certainly have a lot of innovative solutions and collaborations that make a lot of sense, and I think we're very strong in that particular area as well. What about effective outreach and communication? We go round and round about that one. So I think it depends on what kind of outreach we're talking about and the type of communication we're talking about. But I think we could have a pretty lively discussion on that.
I think generally it's bad. But I just think there needs to be a central communication hub where people are pumping information and then it gets disseminated. And it's that way with everything. It's that way with the arts community. It's that way with social things. Like, it's just hard to get information out. I can't tell you how many times I find out the day after an event, what happened, and I think, well, dang, I wish I'd have known that. So I do think that we struggle with communication. And I don't think that's unique to Garrett County, but I just think that that's kind of ubiquitous. With as many communication tools as we have, we use them poorly.
I think Shelley and John actually developed a community calendar where you were talking about it. But well, it is, but it's theoretical because very few people use it.
Right?
So
Getting people
that's
to,
the problem.
yeah.
We have a lot of turnover. Okay.
So once we get people onboarded, then they tend to leave, and then it kind of just gets
It
absorbed.
really, I mean, a lot of it's because there are so many different places to go to find out information. It's hard to get people, the community, directed to one particular source and to know that is where they need to go.
Yeah.
So that's part of the issue too.
It's more challenging now because we just lost the weekender, which I think is an important piece. That was
Lost?
a vehicle, yeah, it's ending publication at the end of the month. So that could be a major communication vehicle that was consistently accessible to every single physical household in Garrett County. And we don't have that now. So that for us has been something that, is a real challenge. The school systems for us, because that's often how we would post those really critical notices that might not be captured in the Republican circulation, which is substantially lower in terms of the number of households that it's delivered to.
And the Cumberland paper is also not truly delivered throughout the county any longer. They do carry some stories, a lot of stories about Garrett County, but I saw a lot of things for Allegheny County in the Weekender titled Garrett County. So I don't know if they did that because they weren't getting enough from Garrett, or if they thought there was enough transportation to get you to things that happen down there. I don't know why, and I didn't know that they were no longer.
We certainly sent them enough for a full paper. So,
They chose not to use it.
yeah, I mean, they definitely, selected what they wanted to disseminate. It didn't cost us anything, which is another huge
Right.
piece, because now when we're looking at how we communicate on a individual household level, that's Becky Aiken and I had that conversation just about a week ago, with the school system and the health department. That's probably going to be, a one-time cost every single time we have to do some sort of mass notification. The radio has been a great partner for us.
Okay.
We had an algae bloom today, and it was on the radio, I think, in like 4 minutes. Like, I just waiting for my emails. But I mean, in terms of like particular older populations, folks who
listen
don't
to that.
have, might not have radio in their home, they might just have it in their car. Like, that's not as consistent as something will be physically delivered to the
I'll
house.
tell you personally, I don't listen to that station primarily because that's not my music.
And I send out tens of thousands of emails. I don't think anybody wants more emails. I don't think we can solve that problem.
And I don't know that everyone even gets email anymore.
So I'm gonna step in and just say that this is a mixed bag for us. There are,
Yeah.
yep, and just in the sake of time, I think we should probably move forward unless there's any other pressing comments.
Move
And
forward.
battery power.
All right, culturally responsive care or services. Is this working well in Garrett County? Do you feel we have culturally responsive care or services?
What does that mean?
I would say probably to the extent that it's needed. But I don't know if it's enough to check the box.
Related to that, I think it depends on how this assessment or this needs assessment is defining culture, right?
Well, that's true. That's a good point. We satisfy our own culture.
And there's no accompanying documentation for us to dig further or understand what they're thinking from the question. So,
And since this is a little more open, just to throw this in there too. The other thing with culturally responsive care is it actually effective? Because if you are to look at like the YRBS statistics and Vervis, when we look at things like tobacco use, we think that we have really culturally competent care, or smokeless tobacco as an example, because the rest of the state doesn't really struggle with that in the same way that we do. They kind of solve that issue. But, is our care actually culturally responsive? Are we making enough of an impact in those statistics? Or is there still room for growth there? Because we came up with a whole campaign at the health department because we thought that would solve the issue, and it didn't solve the issue.
Well, it's not only smokeless tobacco, it's the vaping.
Mhm.
That is a big concern for me, in that it's really more harmful than smoking. Or
that's true.
asthma.
I think we better stick to our script, just to talk about what's working well. Just I'm trying to facilitate. So I completely agree. I think vaping is very harmful for everyone. But just to move on here, as
Shelley,
far as what's working well.
Shelley, Kim
Yeah.
Kim Dovey has her hand up.
Oh, so go ahead.
Hi, thank you. I just had a quick comment. Like when I think of culturally responsive care services, the importance of including the consumer in that conversation. I don't know how much we do of that to really get their feedback on services and like what works for them. So that's just a question as you were bringing up that item.
Thank you. It's a
You don't
very
need
good
an
point.
answer, just I'm like, like, do we really involve the consumer in the process?
it's also worth noting that these are strengths, not areas to focus on. So that comes later.
Right.
Okay, thank you. It's just my questioning.
All right, access to local health programs or clinics. We talked about that when we first started.
Right.
And so I think we all agree that we do have, that is working well. It's just the issue of how to get there. And moving over to I'm flipping a page. You guys have it on one screen. Food security initiatives. How are we doing with that?
Shelley Heather has her hand up.
Heather, do you have a comment?
I do, and this is more on something that I think we need to work on in terms of the local health programs and clinics. I think we need to mention the fact that there's a significant lack of support for family caregivers and a problem with accessibility and availability for in-home care, long-term care, skilled nursing, assisted living, all of that array of services.
Agreed.
Thanks, Heather.
Mhm.
All right, we got a thumbs up there just for the recording. So back to food security and initiatives. How are we doing with that?
Better than we were.
Yeah. Yeah, they're pretty
So, yeah, I think we are doing well, but I think we have tremendous room to grow. So, it's hopeful at this point. It's like a half check box for me.
So John went to get his charger, so he can't type in there. So remember to put half check mark for food security initiatives. Oh, but I think the positive thing about that is the partnerships have increased significantly more than what they were just a year and a half ago.
Yeah. Yeah, I think we're making good strides.
We absolutely are. I still want that rooftop garden thing.
I do.
So, okay, access to mental health resources. What do you all think about that? I think we are still struggling in that area.
Very much struggling in that area.
Okay.
We need more providers. Is that what you're saying?
Absolutely. At any particular time, I could hire 3 additional providers if I could find.
Mhm.
I think we shared in some meetings, we have more public behavioral health providers now than we've had in the last 10 years, but the wait lists continue to increase. So it's providers and then it's the staff within the provider agencies. It's the staff, the clinical staff, like Jennifer just mentioned, that really it's difficult everywhere to find that when you're in a rural area and you have to wait weeks to get in to see somebody. Right. That's a significant problem. That is. And telehealth is not the magic cure for all that. No.
Especially not in a rural area.
Right.
All right. Any other things that are not on the list that you all feel do work well in Garrett County to support our health, individual health, and the health of our neighbors?
John, there's an essential code.
Yeah.
All right,
That's a lot.
hearing none, we will move on to question number 2, which we talked a little bit about some of those, but the challenges that what challenges do you or your loved ones face in taking care of yourselves? And this is a checklist. Just a reminder, question 3 is like a shift and it asks us to think about the future of the community. So, and then there's a 4th question. So we do, just in the sake of time, just want you to know that we can't get stuck in the challenge part. So we already established that lack of transportation is certainly something that we're going to check. It is an issue in Garrett County. Does everyone still agree with that?
Oh, there you go. Shelley, it was just me. Sorry to interrupt. I was going to say, can you scroll down? Very good. I see it now. I have to see it. Thank you.
Did I just checking anything?
Yeah,
No,
we're good. Yeah.
All right, just lack of transportation. We all agree? Yes, no?
Yes.
Yes.
Okay. Housing insecurity or poor housing conditions.
Yes.
Yes.
Definitely. Lots of thumbs up here. All right. And then limited job opportunities or income.
Yes.
Yes, certainly limited living wage jobs and career jobs. All right. Food insecurity. Yes.
Yes.
High cost of care / prescriptions.
I think we're probably in a relative to other communities. I think we're probably in a better position than most, I would think. A lot of access here that others don't have.
How about for the Medicare population of prescriptions?
The way I get 2 of mine is by mail and it costs me nothing.
Yeah. Yeah, the Medicare Advantage programs have really helped the seniors, I think, with the prescription costs.
Yeah.
Um,
And I think the way Mount Laurel manages their pharmacy, they do a really good job with finding best deals.
It's really with the, like, I was thinking the high cost of care for mental health in particular coverage, because so many people do not have mental health coverage.
Yeah.
And so just getting those sessions covered or paid for is challenging.
Yep.
High cost of dental care for those that don't have the right coverage for dentures is a problem. And then the lack of providers to cover their dental needs.
All right, any other discussion about that?
So does that get checked or?
It's, I don't know. I mean, it's a mixed bag, whether you check it or you just leave it in the notes there for.
So, just as a note, we're going to aggregate all of these reports. We've also received 2 online that were submitted by people who couldn't attend either this meeting or Health Planning Council tomorrow. So if you wanted to show in the report, if you believe that there's a good chance, I would lean toward checking it.
Check it then.
Thanks, John. So moving on, a lack of insurance. So I think that's worded interestingly. I think that the problem lies in people being able to afford insurance.
Right.
Anyone else?
Would be better if that said affordable insurance.
Right. And the question always is affordable for who? So it's the cost of insurance. And we do, as we learned from AHEC yesterday, I believe, have, with the help of Mountain Laurel, have navigators and people to help connect people with different insurance. But it always comes down to if they can afford it or not. So Garrett County's positioned fairly well when it comes to coordination of the service, but it's the affordability.
There was an article in the Cumberland paper today about the affordability of the Affordable Care Act into this year and the future.
Oh, thank you. All right, long wait times for care. I believe Fred mentioned that as far as the just behavioral health side of things. And does anyone else have anything to say about just other areas of care?
Dental would also be a concern there.
That was a huge problem.
Dermatology is another one,
Mhm.
actually. I finally got an appointment and I got a letter yesterday that doctor is no longer at the, yeah, I guess.
And that's a pretty good segue into this lack of specialty care, which is the next one.
Yeah,
So
absolutely.
I think JRMC's done a really fabulous job expanding those services for us. But there's still some room to grow.
Still room to grow for sure.
I think that also goes to the transportation issue from the earlier question. We were in a meeting this week, Jennifer and I, with some folks about the transportation survey. And one of the things that the staff at GPS said is that oftentimes at the beginning of the day, their schedule is already full with just medical transport. And those transports take a long time because they have to go to Morgantown or Cumberland,
Right.
sometimes even Baltimore. And so you know, instead of a bus being here in the county where they can do 15 or 20 rides, they do one ride. And so that really the lack of specialties here really cuts into the public transportation that is available.
I'll also say I just wrapped up my research project. I don't have to deal with that anymore. But one of the things I thought was really interesting was the one theme that's carried through every single conversation was that every single person had to go to Morgantown for some type of specialty care.
Yep.
And they talked about all the good stuff that they could get here, but that was still a huge barrier in the transportation. Like that was a constant theme throughout every single interview. And
Some specialists come here sometimes, but not often enough, not frequent enough for the number of people that need the care.
Okay. And then we are back to the mental health provider shortage. We did speak of that earlier. Does anyone have more to add?
We checked that 3 times.
Yes. Okay. And language and cultural barriers. Is that a challenge for us?
That's not a huge challenge.
I think it's
It's homogeneous.
Jillian? Jillian's chuckling.
probably less of a problem here than within some other areas
Yeah,
of Maryland.
I think it's still a problem, not just the culture going what part of the world you come from, but also your socioeconomic culture.
Mhm. Yeah, your understandability.
Yeah, and like, you've got the lower, you've got the higher.
Mhm.
Within those areas as well is a lot of different barriers.
Good point.
Like I can afford to go to Morgantown, especially treatment, but somebody who doesn't have a vehicle doesn't, or they've got kids, they've got to have childcare. So we've got those kind of barriers.
I think if everything worked like language services, we'd be well set because we can request those in almost all Vegas.
Yeah.
It's a request that gets served.
Yeah, I think we're lucky
Which is
there
nice.
that we've got, we do have the language knowledge. But I think if you was in the street, that phones and something like that.
So Jillian, maybe under other, you could put childcare.
Mhm.
That's good.
Yeah, childcare.
Because I didn't see that as in upper boxes.
Although
right.
we have more childcare centers per people than much of the rest of the state.
Yeah, but the
I just saw that
yeah,
stat last week.
a lot of the childcare as well is from 2 onwards. And a lot of, paternity leave is only 6 weeks. What do you do with that baby from 6 weeks to 2 years?
So a lot of them also aren't active. So licensure is not the same as a physical site.
Yeah.
Um,
And it's
we
very
have several
hard,
staff
yeah.
that are licensed but don't no
And it's-
longer
yeah.
operate their own.
And it's very hard to get a childcare insurance and stuff. So it's a big barrier.
There's also some scholarships for childcare, but for the some working class, they don't even qualify for that. And they still struggle to pay for the childcare. So the scholarships don't even help.
Yeah.
And we do have early head start, but they only have expert spots.
Lots of waiting.
Yeah.
Big waiting list for early head start.
Yeah.
Okay. Any other challenges that we want to talk about?
Check
You guys
all the-
can't think of any other challenges? I'm,
Shelby, sounds like you have some.
I mean, I just,
I mean, I think from getting people to change their lifestyle, making lifestyle choices around health is really I mean, that's a big thing to me. It's choosing to eat well, choosing to move your body. Those are definitely challenges that I think are, like the walking challenge that you talked about earlier down in Bloomington that they want to do. Like, I think those are great things. Sometimes somebody challenging me to something will get me to do it. Anyway, I think making lifestyle choices is a struggle for a lot of folks.
I think affordable indoor activities. I mean, we've got a lot of like walking activities outside, but when it comes to the winter months, we've got what, 2 gyms and they're expensive. Like it's something affordable winter activities.
Lacey?
Yes, so while he was speaking, I don't know if now is the place to comment, but, our office, the University of Maryland Extension is going, with the ending of the SNAP Ed funding, that's a huge void in our community when it was previously getting that healthy living, nutrition, healthy lifestyle, physical activity, education to, so many of the elementary school students in our community, plus the family engagement to try to make that, a fun family experience that then extends that reach even further. So we're working for solutions for that, but that's going to be a huge hit to our community.
Thank you, Lacey. The other thing I think we would be amiss if we didn't talk about is domestic violence and our child maltreatment. I know Heather's with us, so we have just, I think, astronomical cultural issues when it comes to domestic violence in this community and also how our children are treated. So I would like to add that to the list. Anybody else? Okay, now we get to move on to thinking more positively and thinking about the future. So when you think about the future of your community, what does healthy rural Maryland look like to you? And we have a checklist, of course. So before we look at the checklist, I think this is always a really fun question when you ask people to just come up with their own vision and think about what it really does look like. So even though I'm not with you in the room, I won't be able to hear you snickering. I think it's sometimes nice to just close your eyes for a minute and just think about what that really does feel like for you, and then just kind of talk about it. Chris, I know you're not afraid to go first.
I haven't had time to close my eyes.
Yeah, okay, I'll be still.
Well, first of all, yes to all of the check all those boxes from my perspective. That's certainly what I would want healthy rural Maryland to look like. I think additionally, going back to the making healthy choices, I really, making making those choices for physical fitness and activities that bring you joy. I think our minds are, what our brains do to our bodies is pretty extraordinary. And I think that if we create patterns of doing things that bring us joy every day, that we're going to be healthier. I went kayaking last night at Savage River Reservoir, and I laughed. I was just so filled. I saw a great blue heron kind of fly over the mountain and then do a rolling dive down to kind of close to the water, and then it flew and landed in a tree. And I thought, I'm the only person seeing this. And there wasn't anybody else there. And so I got really good exercise because I paddled for several miles, but I also just had this overwhelming joy that caused me to laugh out loud. I felt like a crazy person out on the water watching this beautiful thing happen. And I just, whether it's watching kids sports or playing pickleball with your friends or whatever it is, like making choices that bring you joy is really important. And the other thing I would add to that is social connection. I think that people are very isolated after work. Like, there's a lot of isolation.
So having Martin in the HOP area is helping me some because he's happy to be here. And but it kind of gets to what Chris is saying about being joy. Like, I think sometimes as residents in an area, you need to remember about what you like and why you are here. Whether it's because your family connections are here, whether it's because you like to go kayaking or fly fishing. You know, sometimes you tend to overlook what is right in front of you and what you deal with, what you see every day. And, you know, so yeah, remember why you're here and why you like that. Find your blessings in everyday life. Yes, exactly.
Because winter is coming.
And then there's winter.
Yes.
Right? It's so funny.
I'm having Martin up here.
And where did Marcy come from?
Where is home? Where was home?
Well, Anne Arundel County, but I'm originally from Minnesota. So,
And I've already told him that if we have a bad
What-
winter, we're blaming him.
yeah.
He's brought Minnesota.
If we have a bad winter, he won't notice. He'll be like, what are you people crying about?
I don't think it's a loud winter.
Really interesting thing today that I'll throw out here as well. Something that comes up in every single survey we do is that, again, like these constant themes that we hear is that in Garrett County, we take care of our own, but we don't always take care of ourselves. And I heard a conversation today that I thought was really interesting because it was, how do we take care of the people in our community without becoming more or less weathered by that process? And I think that if we're really in a healthy, perfect community, we would be able to take care of each other, but also make sure that we're taking care of ourselves.
I like that.
I think that's
It kind
really,
of gets back to what Henry was talking about, the younger people not participating. You know, I mean, like, they've already put out so much into their families that they're already feeling that weatherization. You know, if we could figure out how to help and strengthen our sense of community with each other.
You need to build a village pub.
yeah.
No, that was, I mean, you said after work. I mean, I know it sounds bad, but you go into the pub for an hour. I mean, you don't even have to have a drink, but everybody's there, local, and then you go home and
They're bringing up kids to it.
yeah, yeah. Honestly, before like 7, 8 o'clock, kids were welcome to the pubs.
Yeah, no, I agree with that.
A gathering place, whatever. you do.
Whatever.
Yeah.
But then that comes back to the communities could do that, but then we listen to people that.
I remember hearing a discussion about the way we started building neighborhoods 50 years ago when we created suburbia, where instead of having front porches and sidewalks, we had automatic garage doors. You open, go in, and there's a fenced-in backyard with a deck, right? Instead of a front porch out looking, and streets with no sidewalks, right? So it's just very interesting how we've isolated ourselves. And I have a friend who moved to Boston years ago, and we lived next door to each other in Clarksburg, West Virginia. And we still, when we greet each other, we still say, "Hey neighbor," and if we need to talk, it's, "Hey neighbor, I need some porch time," because we would always have porch time. And you know, that was gold, right? To sit on the porch for an hour and just chat with somebody.
We used to call it sit on the stoop because anyone houses have that
Yeah.
step, you just
Yeah.
sit there and sit on the stoop.
First project I worked on with Shelly when I started sidewalks. Shelly knows everything there is to know about sidewalks.
Way to toss her out there.
Yes.
That's another thing that the community does like is walking play. Like,
Yeah.
I mean, I never rode a school bus.
Right.
I walked to school every morning.
Me too.
That was just a sense
Well,
of
I could.
community, because you know, it was whoever happened to be passing the bottom of your drive as you came out of the house. That's who you walked to school with.
Yeah, if you want to walk here, you have to drive first.
Yeah. And honestly, that's the one thing my mom did come to visit me once. And she said, "How do you stand this without?" She said, "Without that car you lost." I'm like, "Yep."
Yep.
To get in the car to go anywhere.
Yeah.
Okay. So does anyone have any other things to think about or add to that discussion before we move to the next section?
Hi, this is Kim. I just had one thought. For the coordinated care across systems, one of the things that we had in the state that I moved from, we had like one-stop shops where individuals aren't going like to multiple agencies. Like we had like kind of satellite sites, so like more places where people can get multiple needs taken care of without having to drive another 30 minutes to get across the county.
Thank you, Kim. All right, I think the best way to do section 4 is to pull up all of the areas so we can look at them all at once, because this is the desired use of the funding. And so, as Martin mentioned when we first started the meeting, it's a huge pot of money, and they're really looking for our highlighted top 3 themes that we can hear across all of them. So I think it's important to look at everything that's here first before we get kind of bogged down in one area. So I don't know, can you guys, I don't know, John, can you?
We can
We'll
see too.
probably have to scroll.
Okay.
You'll have to- I
So
would use-
if you're looking at the first 2, maybe just take a minute to do that and then look at the second 2. And then we'll be able to kind of go back, because I just want to give everyone an opportunity to just really take that part in.
Can you enlarge the size of the print, Joe?
I could do that and do one at a time. and
Oh,
I'll also
wonderful.
read them. Funding area, make rural Maryland healthy again. Preventative focus, community-led, cultural relevance, trust building, or other. And these are specific pillars that also align with the federal opportunity. So these are actually dictated by the fundable categories.
So beyond the checklist, then I'll read the little summary that they gave for each one of them. So this is to support rural health innovations, new access points to promote preventative health and address root causes of diseases. Projects will use evidence-based, outcomes-driven interventions to improve disease prevention, chronic disease management, behavioral health, and prenatal care.
The second funding area is sustainable access, which includes facility sustainability, shared services, partnership models, long-term viability, and other.
And that says help rural providers become long-term access points for care by improving efficiency and sustainability. With RHT program support, rural facilities will work together or with high-quality regional systems to share or coordinate operations, technology, primary and specialty care, and emergency services.
The next funding area is workforce development, which includes local workforce pipeline, CHWs, community health workers, retention incentives, professional development, cultural linguistic diversity, and other.
Attract and retain a high-skilled healthcare workforce by strengthening recruitment and retention of healthcare providers in rural communities. Help rural providers provide at the top of their license, practice at the top of their license, and develop a broader set of providers to serve a rural community's needs, such as CHWs, pharmacists, and individuals trained to help patients navigate the healthcare system.
And then innovative care, which includes care coordination, home-based care, flexible care hours, care navigation support, value-based care, and other.
Spark the growth of innovative care models to improve health outcomes, coordinate care, promote flexible care arrangements, develop and implement payment mechanisms, incentivizing providers or accountable care organizations to reduce healthcare costs, improve quality of care, and shift care to lower cost settings.
And then there's tech innovation, which includes telehealth, broadband, cybersecurity, data sharing, app-based tools, and other.
Foster use of innovative technologies that promote efficient care delivery, data security, and access to digital health tools by rural facilities, providers, and patients. Projects support access to remote care improve data sharing, strengthening cybersecurity, and invest in emerging technologies.
So that's good teamwork. Thank you, guys. I think it's and our top three.
You turned into a robot.
I don't know what to do with that. Can you guys hear me now?
A little bit.
Does someone else want to take over this part since I'm turning into a robot? I'm in the same place. It's still like parked, but
You're good.
I'm good now. Okay, sorry. So a lot to take in here. Thank you for the good teamwork. I appreciate just having everyone get a sense of where we're going. Those are huge areas. And again, they're asking for feedback for how the desired use of the money. They're looking for the top 3 themes. So we get to be a participant and help them understand how to help us. So who wants to start?
Prevention focus.
Yeah.
So that's
one else-
under Make Rural Maryland Healthy Again?
On a second though, do we only get to pick 3 from all those categories?
They want us to focus on
3 in each.
They want the final report submitted to focus on 3.
So
Okay,
we need you guys' input on all of them.
right.
So then that with the report that we have to compile to turn in will
Reflect what,
reflect
Yeah.
the whole thing.
okay.
Great.
Can you scroll?
John, for this part of the discussion, I have pulled up like what Jennifer was reading. Do you want me to share that so then everybody can see it on one?
Yes, take
Okay.
over. Yes, I will continue checking.
I would check the community led as well. I think just from the previous conversations, so much, especially with the rural area, how much community is so important, which leads to better health outcomes as well.
We did talk earlier about the need for in-home care, be it for children or individuals of a certain age who need help within their home. Maybe it's help with cleaning or, it could be help with care as well, personal care.
I think that tech innovation as well, because like you say, newspapers are going to be a thing of the past and everything's going to be online. And we still have a lot of areas in the county that you've either got no service or you lose service when you go through that area.
So, but I think specifically under tech, and because there's categories under each one of those
Mhm.
that we're not seeing. So data sharing, I think, is important.
Yeah.
Because everyone gets caught up in this HIPAA silliness, and they don't understand that you can share information that's not really HIPAA related, but they refuse to do it, especially in the hospital systems. Refuse to share data.
Yeah, so we need a broadly adapted EHR that is interoperable and will share the data.
That would be great. If that could exist. Probably does, just refuse to. So we might have to have people go back, because can we see the different categories under each area?
No, these are different documents. So I can screen share again. Hold on a second.
Just check them out. Is it the links?
I'm
Well,
hoping
this
they
one's
can't see
giving-
that box. So to Jillian's question, Jillian, are you talking about, when you're talking about like technology and access, are you talking about broadband or is it something different?
I think broadband, because you can
Well,
go
I
back
mean,
to the area.
that's a very good point. I mean, even if statewide they're talking telehealth, that's a problem for us because of our lack of broadband.
Yes.
I thought they were working to correct that.
We are.
And
As we have been for at least 10 years.
And you can correct it today for about $600 if you can afford Starlink.
Yeah.
Right. It's cheaper now. I
cheaper
just bought
now.
it.
Yeah.
It's cheaper.
Yeah, I think it's what, like four,
It was 175,
Oh.
and I just saw it on Facebook ad that it was down to 90.
like the equipment though, or
The
the
equipment,
service?
and then
Yeah.
it's $120 a month.
Yes, so if you could pay, you could jump the line.
It's like
The
Disney.
rest of it is, several years, like the broadband plan is phased in over, I want to say, many years. Yeah, and some of that also was canceled because the funding for some of that might not stick around.
So it's hard to look at these categories and then choose 3. Because some of it we're working in some of these categories already, like we're doing remote patient monitoring. I heard Mount Laurel say yesterday on the HERT call that, or the day before, that they're doing remote patient monitoring. We just started remote patient monitoring. The hospital had done that. So some of it we're working on, and providing funding to expand that would probably be a good thing. Obviously, I mean, we can make a lot of plans, but if you don't have the skilled workforce and you're not attracting people and retaining people.
Yeah, I think creating a community that is welcoming to folks, like, we are a very homogeneous county, and that makes it very difficult. So if somebody is from a foreign country and needs to, in order to stay in the U.S. to practice medicine, they have to go to a at-risk community. They could come here, but are they going to be welcome here? Right? What does that look like for somebody? So, really focusing on creating a welcoming environment for people.
Can we indicate check boxes we're going through? Because I'm not
Okay,
sure
sorry.
what either of those two were.
Yeah, no,
They might be
sorry.
others, but let's make sure we get that wrote down.
Cultural linguistic diversity would be, and retention incentives and local workforce pipeline. I think as our community ages, we're going to need more and more in-home caregivers than we have not enough now, and we're just going to need more. So finding a way to develop that workforce that will allow people to age in place is really important. And finding funding streams for that.
And Jennifer, what
So
was
what a,
the category?
I'm sorry.
Well, I mean, so down in innovative care was the remote patient monitoring. Is where that is
Like an
actually
other then.
listed. Yeah.
Okay.
So I have a question about sustainable access and the facility sustainability. I don't know if you can reread that description, but agreeing with both Jennifer and Chris, the other, I guess the first part of that is being able to, right, have the infrastructure in place before you can attract and before you can welcome. So we have to have places for people to live, and we have to be able to upkeep our infrastructure and have some of the basics done before we do the other things.
Absolutely. So other would then check other and put infrastructure.
Infrastructure, right?
But definitely check facility sustainability, which Martin and I were talking earlier today about how the payment models, they don't cover our costs. Like we're always in the hole because the insurance payments just don't cover our costs. And so at Health Planning Council, I'll probably go into more detail about that because it'll be more provider based, but talking about offering FQHCs get special provisions and increased rates. You need to offer that. It needs to have a rural modifier on our billing codes, if not a bundled service type of that thing. Expand the definition of what a rural health clinic is, those type of things. That would help greatly with provider sustainability.
And I need to share yet.
So scroll back up to make rural America healthy again there. Make sure we got it. Definitely the preventative focus that aligns then with what Lacey was talking about with SNAP Ed. The outreach.
I have been there, trust building,
But
trust building, because it's still like trust, because you still hear, even though the hospital is improving, there's still a lot of people who say, "Don't take me to Garrett." Yeah, just don't take me to Garrett. Garrett's a bad station. Take me to Morgantown.
it's called a hospital bypass.
Yeah. Well, I'd actually
Facility bypass.
Yeah, having had a daughter who's worked in the healthcare, she has actually, I mean, this was in West Virginia, but she has actually told ambulance drivers, don't bring them here, take them straight to Morgantown. They're going to have first play, especially for mental health. She'd say they get first pick of Chestnut Ridge beds, take them straight there, rather than sitting here in my emergency department. So I think there's still, a lot of trust and going to, and even going to local doctors. Some people still don't want to go to the local doctor. They'd rather take, if they can do it, they'd rather go to Morgantown. Yeah, they like, sometimes it's like what they'll say quality of care, but they'd rather go there. And I also think there's still a lot of stigma about people coming to the health department because they don't trust, because it's local and local people work here because they're trusted. Is it going to be kept within those four walls?
Especially mental
Yeah.
health care. Yes.
And our trust took a hit after COVID. Like,
Yeah, and
it's a very different
yeah.
conversation.
And I like the substance use disorders as well. It's not, they don't want to come here because have not. Is it going to stay within that building?
All right, are there any other thoughts or any other concerns, anything else that we want to make sure we submit based on the discussion we've had today?
When is this being submitted? Is there time
But
after this meeting?
end of the month.
Okay, so if
Okay.
someone thinks of something after this meeting, they
Yeah.
still have time to.
And I'll get Jillian or Lindsay to send out. You can also submit your thoughts on your own. There's a separate survey link on the state rural health office, Office of Rural Health. So you can, if you don't feel like you were represented in this conversation, or you just want to re-express your own thoughts, you can certainly go on there and complete the form yourself as well.
And this will stay up until the afternoon next Thursday. Health Planning Council will bundle this up so we can bind it into a PDF. And if you have a specific project, that form even lets you submit like a specific thing you want to do. It's not even like this broad. It's like literally like submitting almost like a grant, even though they're not going to fund it. That's been super clear. There will be future competitive rounds, but you can submit specific projects as well.
Does that bring us to the end, or is there more?
That brings us, I think that brings us to the end of this discussion. So hearing nothing else, I'll kick it back to you, Chris. Thank you.
Thanks, Shelley.
So you want me to end
Thank you
this
all for
recording?
participating in that conversation.
Yes, you can end this recording. Thank you.
All right.